Hi, I'm Dr. Siddish Prabhalingam. I'm working as a junior clinical fellow in Obs and Gynae at Lieutenant Dunstable Hospital. Well, I heard from many of my friends who have attended the emergency courses at Bromley that it's a very well organized course, and I was interested in learning more about Obs and Gynae scanning in particular. So, word of mouth, I heard from my friends, and so I thought I'd give it a try. And also, I wanted to get CPD points for my appraisal. So, this was a wonderful course to attend. So the lectures before every practical session is very brief and concise and on to the point. We learned today about early pregnancy scanning and obstetric scanning and gynae scanning. So it's a wholesome approach to whole obs and gynae curriculum, and it is based on the recommended RCOG curriculum for ST1, ST2 trainees. So it's very relevant and recognized for CPD points. After every lecture, we have a practical session for around 40-45 minutes where we have real patients, pregnant ladies, and normal patients, and patients with IUCD in situ. So it gives a very good practical and theoretical approach to learning obs and gynae scanning. This is a very highly recommended course to learn about obs and gynae scanning, the basic one, of course. Very useful for ST1 to equivalent trainees, or also for junior clinical fellows or international medical graduates who are trying to apply for SHO level obs and gynae jobs. It's a wonderful course to attend, highly recommended.